Medical communication for 7th semester medical students. Medical communication is the ability to interact effectively with patients, their families, and other medical team members. In the 7th semester, the focus on medical communication deepens as students face complex clinical situations requiring professional, empathetic, and ethical communication skills. 1. Goals of medical communication. Building a good doctor-patient relationship, establishing trust and comfort between the patient and the doctor. Improving patient adherence to treatment. Clear education encourages patients to follow the treatment plan. Understanding patients' holistic needs. Addressing not only physical but also psychological, social, and spiritual aspects. Enhancing the quality of healthcare services. Effective communication reduces the risk of miscommunication, diagnostic errors, or malpractice. 2. Key components of medical communication. A. Basic communication skills. Active listening. Listening to patients without interruption to understand their concerns. Example, nodding or paraphrasing the patient's statements to show attention. Empathy, demonstrating understanding of the patient's feelings. Example, saying, "I understand this is a difficult situation for you." Using clear language. Avoiding medical jargon that patients may not understand. Example, replacing hypertension with high blood pressure. Nonverbal communication. Using appropriate facial expressions, body language, and eye contact. B. Structure of medical conversations. Opening the conversation, starting with a warm greeting and introducing oneself. Example, "Good morning, I'm Dr. Name, and I'll be helping you today." Exploring the chief complaint, asking specifically about the patient's issues. Example, "What brings you here today?" Delivering medical information. Explaining the diagnosis, treatment plan, and prognosis clearly and understandably. Example, "You have a urinary tract infection that requires a 7-day course of antibiotics." Closing the conversation. Allowing the patient to ask questions and ensuring their understanding. Example, "Is there anything else you'd like to ask before we finish?" 3. Types of communication in clinical contexts. A. Communication with patients, pediatric patients, using simple language and involving parents. Example, "We'll use a small needle to check your blood, like a tiny ant bite." Elderly patients. Paying attention to psychosocial aspects like anxiety or fear of death. Patients with mental disorders, providing reassurance and avoiding judgment. B. Communication with patients' families. Providing clear information. Example, "Your father's condition is stable, but we need to monitor his blood pressure for a few more days." Managing emotional families. Showing empathy while delivering clear education. C. Communication with other medical team members, interprofessional collaboration, communicating effectively with nurses, pharmacists, and other doctors to ensure integrated care. Medical case discussions, delivering patient reports concisely and systematically. Example, using the SBAR method, situation, background, assessment. Recommendation. 4. Challenges in medical communication. Patients from diverse cultural backgrounds. Challenge. Differences in values, beliefs, or cultural norms affecting healthcare decisions. Solution. Respecting the patient's culture and adapting the communication approach. Patients with fear or anxiety. Challenge. Patients who are too afraid to speak up or follow treatment. Solution. Providing reassurance and ensuring they feel heard. Conflict within the medical team. Challenge. Miscommunication among team members that may impact patient care. Solution. Enhancing collaborative communication skills. 5. Specialized approaches in medical communication. Informed consent. The process of providing information to patients about medical procedures, risks, and benefits. Steps. 1. Explain the purpose of the procedure. 2. Outline its risks and benefits. 3. Allow the patient to ask questions. 4. Obtain written consent. B. Breaking bad news, Spike's method. 1. Setting. Arrange a quiet room with privacy. 2. Perception. Ask what the patient already knows. 3. Invitation. Determine how much the patient wants to know. 4. Knowledge. Deliver information clearly. 5. Emotion. Allow the patient time to react. 6. Strategy. Provide the next steps. C. Motivational interviewing. A technique to help patients change health behaviors. Example. Helping patients quit smoking by exploring their internal motivations. 6. Evaluation and practice in medical communication. A clinical case simulations. Students practice communicating with simulated patients or actors portraying patients. B. Feedback from instructors on simulated patients. Students receive evaluations to improve their skills after simulations. C. Documentation and reporting. Recording patient discussions in detail and ethically in medical records. 7. Expected competencies. After studying medical communication in the 7th semester, students are expected to 1. Build professional relationships with patients. 2. Use an empathetic communication approach. 3. Deliver medical information clearly and effectively. 4. Handle difficult situations, such as delivering bad news or managing family conflicts. 5. Communicate effectively within the medical team. Medical communication is a vital skill that continues to develop with clinical experience.